We can angle it so someone else, if you guys want to be on camera.
No, we're good.
No, we're good.
You're great. Thanks, ladies. Yeah. Okay, so I guess we're live. So I know a couple weeks ago we discussed a little bit of equine vitals, but today we're going to go into more of the first aid portion of it. So I had this one out a couple weeks ago. This is just your when to call the vet. So we're going to talk about different emergency scenarios and, you know, what to do in that scenario. We're just going to talk through some things. I wanted to hear your thoughts. We'll discuss some common sense and we'll go from there. So this is your when to call a vet poster that we talked about last week. So, or 2 weeks, what was it, 2 weeks ago, 3 weeks ago? So vitals out of normal range. I know we talked a little bit about what your vitals should be 2 weeks ago, last time we talked about first aid. They're on here if you want to check again. But anytime your horse's vitals are out of normal range and you cannot see a clear reason why, like, you know, they're stressed, they just worked, they're in a new environment, something like that, that is a reasonable explanation for why your horse's vitals are out of whack. But if they're just hanging out in their stall and they are panting, that's a problem. And then from there you can discern if you need the vet or not. But that vitals out of normal range are what's going to tell you we need to look into this. So we're going to talk about some of the basic injuries you'll see and what you can do to help with them. And then, yeah. So all sorts of, several kinds of injuries. I know we talked, or several types of cuts, if you will, or ways that a horse can bleed. So your first is going to be an abrasion. And abrasion would be similar to skinning your knee. You're taking off top layer or so of skin, and it's going to bleed. But yeah, it's going to look like you skinned your knee, something along the lines of that. To treat it, for treating pretty much most of the wounds we're going to talk about, when in doubt, flush it out. So for flushing, you can use a hose, or if that's not available, get yourself a giant syringe. This one is like 60 milliliters. So you fill it up with, preferably you have some kind of saline solution, but if that's not going to work, as clean of water as you can, and just flush it out. Thank you, Empress.
Is there a location where horses are more likely to get abrasions, or can it literally happen anywhere?
It's an anywhere thing. I have seen them pretty much anywhere. I know a couple of you guys have seen them on the ponies, especially when they've had a bit of a wild night in the pasture, and you might see like a bite mark. That's usually just an abrasion because it was a surface layer. Or, you know, I rubbed myself on the fence and, you know, gave myself a little scratch. So abrasions are scrapes. Flush them out, and then you're going to grab some betadine. Wipe it out, working from the center outwards, because you don't want to bring any dirt into the wound. You want to work it all towards the outer edge. So you're going to scrub with that for about 30 seconds, and then you have several options for what to do next. So I've got a couple of the ointments out here that we use. So Corona and triple antibiotic are going to be some of the biggest ones you'll see. Corona covers it like a band-aid. It's got some healing properties, but if you want to use antibiotic, put this on first and then put a Corona on it.
Which is the one that smells like bacon?
This one.
Oh, okay.
Corona. Corona smells like bacon. Let's see here. I've got another wound care cream. There's all sorts of stuff on the market. It kind of just depends on your wallet, what you want to spend, what ingredients you value. I know where I went to school, we really liked something called Coat Defense. It's a paste. You can also get it as a powder, and it's all natural ingredients, so that's pretty great. It smells like mint, but if you want something that is just, it's strong and you'd prefer a chemical because sometimes those do the job better, it's up to you.
In your experience, what's most effective?
It really just depends on your horse. I've used Corona. The only issue with Corona is it doesn't dry. So it's always going to have like this wet film over your horse's wound. The Coat Defense that I use dries kind of like a clay face mask because it's a clay. That stuff dries and protects just a little bit better, and you don't have to reapply it as often as you do Corona. But on the other end, it's going to be more expensive because it is natural. So we've got SWAT, which is more of keeping flies out of it, because let's face it, an open wound is going to draw your flies in. So this works to say no, or the flies will get on it, but they won't be able to get into the wound itself. And then we've got Wonder Dust, which is good for helping clot bleeding. So we might talk about this a little bit more when we talk about lacerations, but it's good on like a larger abrasion. If you're like, yeah, the bleeding's not stopping, you've tried cold hosing and it's not enough to call your vet, and spray a little bit of this on there is just going to help dry it out, clot it a little faster. And then we've got Blue Coat.
Is that Wonder, or what's it called?
Wonder Dust.
Is it literally just like dust, kind of?
It's like baby powder.
Wonder Dust. Yeah, it's quite literally a dust. Alright, and then Blue Coat is one last thing we can talk about. Blue Coat is another wound dressing. Really good for your fungal infections. I've used it on rain rot several times. If you couldn't tell by the name, it is a very certain color, and don't try to get it on your hands because it will not come off for several days.
What color is it? Just blue?
Bright purple. It is aggressively purple. So put those away. So yeah, all of these we can use on an abrasion, and you might use them on lax and punctures, but it really varies from case to case with those. We've also got some vet wrap and some gauze you might use, especially on the legs, or something wrappable, but otherwise you might just use gauze as a vessel for your iodine. And then we've got some hydrogen peroxide. Does anyone know why this is a bad idea?
Stings.
Well,
Yes.
it brings the flesh out, like I forget the term. But
So hydrogen peroxide actually destroys cells, which is why it's great on bacteria, because it's causing them to explode from the inside out. However, it's also going to do that to any of the body cells. So anything that's coming to, help fight off infection, clot, is also going to get destroyed.
Yeah.
So
And so
hydrogen
you don't-
peroxide is,
what would
yeah,
you use it for?
honestly, I wouldn't.
For anything?
I personally wouldn't. You might use it on an abrasion, but nothing deeper than that. It's also fantastic if you combine it with Dawn dish soap, getting a gray horse actually gray and a white horse white. Beautiful stuff.
Really?
Well,
That's
it's
useful.
how blondes become blonde.
Is that what you do?
Yes.
I love that for you. Alright, so the next type of wound is called a laceration. So that would be a long cut. So, you've ever gotten yourself caught and it kind of tears the skin a little. That's the kind of thing that's usually going... For humans, it's going to need stitches. For horses, it's up in the air. It depends on how deep it is.
Laceration.
Yeah, laceration. So, yeah, that's a deep, long cut. Lacerations are a problem if they are deep.
What's
Because-
a laceration?
That's that long cut we talked
Oh,
about.
okay. Just trying to remember the
Yeah.
names.
So that's what's going to happen if it's deep. I can totally think right now. So
How can you tell if it's if you need stitches or not? Like it's deep, but you can't stop the bleeding.
anything
like
you
the pressure,
cannot stop the bleeding. Any rule of thumb is anything over about a half a centimeter might need someone to look at it.
Okay.
Or at least
In depth or in length? In depth.
Right. Depth.
depth. Because in length, I can have a really long one that's superficial, and I
Yeah.
can treat that just fine.
It's like a
But-
scratch on the fence.
Yeah.
Do vets ever need to cauterize the cut,
Occasionally. So
depending on where it is?
usually with horses, your first line of defense is cold hosing. Just
Okay.
get it cold, hose it off, because that's going to rinse the blood away. It's going to rinse all the dirt away.
First step.
If you have a laceration that is deep, you need to call the vet immediately, because the horse is going to start healing. It's pretty much as soon as they get injured. So the longer you wait, you only have like 3 or 4 hours
Shock wears off.
before it's actually it's starting to heal and the skin starts to die. So if you call after that 3 to 4 hour sweet spot, the vet decides you need stitches, they actually have to cut away some of the tissue to reopen it, and then they'll stitch it closed. So yeah, if you suspect stitches, call quickly. The other one that would require a vet is if it happens on a joint, so knee, fetlock, hock are your big ones, or eyelid. Eyelid ones are absolutely nasty to deal with, but if it's in any of those areas, that's an instant call to your vet, because inside the joint is something called synovial fluid. That's what allows your joint to actually move around and wiggle, and that stuff is completely sterile. There's no bacteria in it. So if you get bacteria in there, you're going to get a joint infection, and that's when we start to have problems. You'll generally see arthritis after an infection, and they're just horrible to treat.
What does the vet do in those cases?
Clean it out, antibiotics.
Stitch it up.
Yeah, when in doubt, they're probably going to stitch it up.
Topical antibiotics or oral?
Probably both.
Okay.
At that point, you're probably going to be giving out some kind of SMZ. We had a horse come in at my barn a few weeks ago. We don't know what he did, but he decided he wanted to just split his lip. So he was we were disinfecting it twice a day with a new topical antibiotic afterwards, and then he was getting antibiotics twice a day orally.
SMZ?
Yeah. So SMZ is an antibiotic that they take by mouth.
Okay.
Super not fun to administer for most horses.
They don't like the taste.
So I get the joints and the synovial fluid. What's special about the eyelid?
Think about the location for a moment.
Yeah.
So a lot of eyelid lacerations you're going to see is quite literally the eyelid is now split in half, or part of it is hanging off.
So now it's not protecting the eye.
Yeah. Also, I mean, I feel like you might also panic if part of your eyelid was just dangling.
Yeah.
I would.
Yeah.
I mean, yeah.
I would pass out.
Yeah, no,
I'd be like so grossed out. Yeah.
It's disgusting. I've had to see it on a few horses.
Plus, they could hit the eye.
Yeah, so, yeah, just eye in general, get a vet out.
That's an
get a
infection
vet.
that's awfully close to a place where you really don't want an infection.
Yeah, so eyes and joints, get your vet. Anywhere else, get a vet if it's deep looking. Like, if you would consider getting yourself stitches, get your vet out there. Alright, so the last one is a puncture, so that's going to be, well, let's face it, that's like a stab wound or like a giant thorn, something like that. A foreign body entered and left a hole. Punctures are especially bad on the joint, once again, because of that fluid.
What do you take? Like, say it's like a thorn or something stabbed
Or
into it.
Leave
What
it.
do you
Leave it.
Just leave it in.
Leave it in there. Puncture, instantly call a vet. Puncture, I have yet to hear an excuse as to why you shouldn't call a vet, especially if the object is still in there.
So,
Because that's going to be stopping the bleeding.
And more dirt coming in.
Yeah.
I am familiar with cat bites and dog bites being punctures. Are horse bites ever punctures?
Rarely.
I mean,
They don't have the
shaped
teeth for
differently.
it.
Okay. So that's more likely to be your laceration or your abrasion.
Yeah.
Or it could be a nail sticking through a fence. And they,
Yeah.
Yeah, I've seen nails through the fence. I've actually seen a puncture turn into a laceration that way. Your horse gets impaled with a stick. It happens.
they run through a fence.
Yeah. Something went in and it's not coming out. And in that case, you can cold hose it, but biggest thing is going to be keeping your horse still while you call someone to help you.
And I think you had mentioned in part 1 of first aid that you don't flush the punctures.
Punctures you can flush.
You can.
You actually want to, once you've been given clearance, because punctures need to heal from the inside out. So they're going to scab over, as any wound would, but you actually have to take that scab off a couple of times a day to air it out, because it needs to heal inside
Do you
out.
flush before the vet comes out? Or does that depend on what the vet says?
Your vet's gonna.
Okay.
Yeah, so it depends on what your vet says, especially if you're unsure, just ask your vet. They're usually gracious enough to be like, yeah, you can flush it out, and sometimes they're like, wait till I get there. But you're gonna flush cold water, or like I said, saline's your better option. And you're gonna be like, where do I buy saline? Contact solution.
Yep.
All you have to do is get a bottle of contact solution.
Have the vets ever not wanted to show up?
There might be times where they're like, where they'll say, you know, this is something you can take care of on your own, and you'll know, like, a tiny little puncture, usually you don't need the vet, but most of the time they'll want to come out and take a look at it, especially if you're feeling concerned about it, like if you're slightly more inexperienced with horses or as an owner. Whereas, like, where I went to school, we had a vet on staff as well as, you know, professors with plenty of horse experience, so sometimes we didn't need to call the vet out. We could usually take care of it ourselves. So that is the 3 ways you can make blood flow on a horse. Any questions on that?
How would you care for a hoof where the frog has been punctured, where the hoof wall has been punctured?
Yeah. Oh god, it's not fun.
I don't love asking the question because I know generally what the answer is, but you know, is that an automatic do not pass go, do not collect $200, call the vet? And
It's generally a call the vet because I know I told Deb about this last week. The frog is this V shape in the horse's hoof. It's squishy,
Yeah.
and it's actually part of the horse's circulatory system. With each step the horse takes, the frog contracts and sends blood back up the leg. So if you have a puncture in that, we're gonna bleed, and we're gonna bleed a lot. You're gonna get infection in there quickly. You're looking at risk of founder. So we're gonna soak it, and we're gonna call a vet. You're probably gonna be on antibiotics. That hoof is gonna be wrapped and packed to high heaven. Yeah. And it's always fun. We had one with what we thought was a small puncture a few weeks ago in their hoof, and packed it with cotton, flushed it out a couple of times a day with betadine, and it seemed to be working okay.
So I was going on a trail ride once, and like the horse that I was riding, she started to bleed at the back.
Mm-hmm.
I don't know where it was. My mom spotted it, and do you think it was a good idea? We had like another hour left. Do you think it was a good idea to wait, or should they have treated that quickly?
Well, it depends on what kind of injury it was.
It was just like a little cut, but
A little cut, they're fine.
Okay.
Like, if it's just, you know, something negligible where you would have kept going, horses are going to be very different than us. We can't just put a Band-Aid on it. And, I mean, if you're out on the trail, generally someone's got at least a minor first aid kit.
Yeah, we were riding Western style, so they had.
Yeah, generally someone's got some kind of minor first aid kit, so you might try to flush it out with someone's water bottle. And then, at that point, you'd put just some kind of wound paste on it just to cover it up till you can get back.
They just put spray on it.
Yeah.
When I got back.
Yeah, you're perfectly fine in that scenario. If it had been any different of an injury, I might say differently. So, let's see here.
I have another question. We talked about eyes, we talked about joints. How about the inside of ears when things happen there?
Ears are always, anything on the head is an issue, especially if it's bleeding, because you've got the brain. So, bleeding mouth, not ideal. Bleeding eyes, really not ideal. Bloody nose you'll see occasionally, and it can mean absolutely nothing, but if it's like pouring out,
Yeah.
it's a little bit harder to stop a nosebleed on a horse than it is on a human.
Mm-hmm.
Ears, yeah, because ears affect balance and you don't want all that fluid going in.
What bleeding thing on the ear? Like, what would be a common cause for that?
That's going to be your cuts and lacerations. Another thing is a lot of horses,
Scratching trees.
yeah, some horses can get fungus up there and they get these like fungal growths.
Yeah.
And if they get those scratched up enough, sometimes that can lead to some bleeding.
Bugs.
Bug bites?
Yeah.
Bug bites generally don't require a vet. The only exception is if your horse got bit by a tick and you're noticing lethargy, muscle tightness,
Yeah.
things like that, because then you're generally looking at Lyme or anaplasmosis. But the best way to prevent that is, check your horse daily for ticks, especially during the tick season. Pull them off and then instantly scrub wherever you pulled it off from with a lot of betadine.
And they have topicals that you can put, like Freedom
Tick poop.
tick
Yeah.
stuff.
Yeah.
Like, just like your dog.
Yeah, most of the horses here have some on right now. We just did a reapplication last week.
How often do you need to applicate it?
We do it about once a month in the summer. So it goes on just like flea meds for a cat or a dog, except we have to put it in several spots because there's a lot of area to cover. And most of the horses are cool with it. I say most because some of them are scared of dripping sensation. Connor. And Empress. Oh my god, Empress almost killed me. But
Empress is watching. She just like gave you an
An evil look.
Empress.
Don't say anything about Mareface you don't want to live on in perpetuity.
That mare loves me.
You have like a hate-love relationship.
It's a very much love-hate relationship. Alright, so yeah, bug bites. Not usually. So
Can we just take a moment to admire Jen's Fresh Prince impersonation?
I like it.
honestly it's fantastic.
Really
The way I can feel my ears starting to get warm, and there's literally no shade, so
That's
yeah.
fantastic. Alright, so we've talked about that. I'm trying to think. So we can talk a little bit about colic and if you see colic happening. First signs of colic, no interest in food, no interest in their water. You put your ear up to their gut and you hear minimal gut sounds or none at all. That usually means something's blocked and not moving. Sometimes it's just a gas colic and they need to get it out. Other times you've got something stuck and nothing can move past it. Or worst case scenario, their intestines have flipped and twisted.
What happens when they're like flipped and twisted? What is?
So
what do
I
they
had
do?
the unfortunate experience of getting to firsthand know what that is in February when it happened to my friend's horse. It's usually life or death, and the nearest. Well, surgery is an option, but it's $15,000 at least, and it would have been a 3-hour drive to the nearest veterinary hospital. So usually there's another decision that's made.
And so is it like when they're like all the organs are like twisted or something?
Usually it's just the intestines, but they'll flip on themselves and just twist like sausage links.
It's
Yeah,
very painful.
it's incredibly painful, and so you notice colic. You're gonna pull hay and water immediately. Nothing comes in until something goes out. They poop. Okay, great. You can have a handful of hay, and we'll just try that every so often. You can't really stop a colic. You can make it comfortable. Like once colic is started, there's something called Sezwo you can try. It's pretty much the same as our version of a Gas X. It's a tube of this mint flavored clay type paste. You give one tube, wait a half hour, give the other tube, and usually that can help get things moving.
What is that called?
Sezwo.
How do you spell that?
SAYSWOAH. It's about $80 for one treatment, but I've used it several times and it did what it needed to do. And I'd rather have a comfortable horse than worry about the money aspect.
Yep.
Now, is that for gas colic or is that for any colic that it might
That's
have?
going to be a gas colic. You can give it for any colic, but it's only going to touch a gas colic.
Is there a way you can tell if it's gas colic or some other type of colic?
Another type of colic, they're generally going to be in more pain. They
The
really,
intestines.
yeah.
They'll
Are
lay
they
down.
gonna-
They'll start biting at their sides.
Yeah, I mean, they'll do it for gas colic too, but they're going to be in significantly more pain.
Okay.
When the horse is colic, are they gonna like buck and kick, or are they?
They're
just
gonna
not-
kick at their belly, they're gonna bite at their belly, they're gonna try to roll, get some comfort, because they don't understand what's going on. It just hurts. So what they're gonna do is pretty much bring all of their attention to it, like, hey, it hurts here. The other thing you can give is Banamine. So Banamine is a fever reducer and a bit of a painkiller. So you can give that, and it wears off after about 6 to 8 hours. So if after 6 to 8 hours your horse is improved, great, you're in the clear. If not, then you're gonna call your vet. Because that means the colic has not passed, and that was one of the unfortunate things about my friend's horse is we gave him Seswo and Banamine, and it just didn't
Touch it.
yeah, like he perked up, he ate, and we were like, oh, he's good, but other signs were missed, and yeah. So if you administer Seswo or Banamine, remember that eventually they're going to exit the system. So after 6 to 8 hours, if there's been no improvement, call your vet.
They also tube them too, like that will tube a horse, right?
Occasionally, if there's a blockage, so that you might tube them, flush them out with mineral oil.
Yep.
Which just lubes things up and sends it out.
Yep.
Your other option is surgery. And like I said, it's not cheap, and it's a very hard decision to make. I was part of that decision, and it was, neither side of it feels good. Like, you feel like you're making the wrong choice either way.
What is the success rate for surgery?
Not
I
high.
don't know. Yeah, I know, it's not
High.
It's not,
Depends on the age of the horse too.
yeah, it depends on the age of the horse. It depends on the severity, because sometimes if the twist is there long enough, the tissue becomes necrotic and dies, and then you actually have to remove sections of the intestine.
We had a lady at our barn. Her horse was starting to colic bad, like biting the sides, and want to lay down and not move because it hurt so bad. And got him up. Got him. Since we're here, a lot of good vets nearby She did like partial surgery. So it was Piedmont. They opened it up and they found that the horse had a big tumor that was
Yep, that'll do it.
wrapping itself around the intestine. So they removed the tumor because the question. And the horse was old. The horse was like 21, 22 or older.
Yeah, that is older.
So it was a question: does she spend 10 to 15,000 in surgery? And the vet said, well, we can just open it up, and if it's a twisted colic and necrotic, forget it. And then if it's something else, which it was in this case, they removed the tumor. The intestines were largely okay. They sewed the horse back up, and the pony is doing very, very well.
Yeah, recovery is going to be awful from it, because now you have a horse with an incision that's pretty much stem to stern.
Yeah, it was
like going in there, you're looking at least a 12-inch incision.
So they're not doing this laparoscopically.
No,
you're going to get in there and you're going to get down and dirty.
Yeah, it was like stall rest for 6 months, and then they had put together an outside paddock where somebody could keep an eye on it, and then
they're wearing a bandage that kind of looks like a corset, because it just takes up an entire barrel.
Yeah.
Sometimes they need help, like a little extra support standing. It's a mess.
A corset is an older type of undergarment that wraps the
Like
wraps your
exoskeleton.
in the human application it wraps the torso.
Think of like a tube top, so like a shirt with no sleeves. They're gonna be in one of those.
So with tubing a horse, which end of the horse does that happen from? Or it could be either.
I've seen it go from both. Generally, they're gonna go up the nose.
And then push out the back.
Yeah, up the nose, out the back. I rarely see it go the other way. I've actually seen it go
What's
the other
going
way.
up the nose?
A tube if they decide they want to try to flush it out.
Oh.
So, yeah, you just take a tube all the way up the nose. It goes down their throat into their stomach, and usually they're gonna pump a lot of mineral oil through it.
So they get the syringe and have mineral oil and water mix.
What type of imaging is available without moving the horse to a hospital?
Not much.
Okay.
You can do X-rays,
You can, but X-rays don't really do much on soft tissue,
right? They don't take it.
and
They have
your guts are soft tissue.
they have like a sonogram machine that they can.
Yeah, they can. It just depends on what your vet personally has and what they're able to bring. But usually you're gonna do things as more externally. Like, we all know horses have a bit of a dip in their side right here. One of your first signs of problematic colic is that's gone. That just swells up like a balloon. It's gone. So that's one of your signs that gas is starting to build up. You're not going to hear the gut sounds. They're not going to have, pooped in several hours at this point. Horses poop at least 8 times a day. At least. I think it's actually closer to 10 to 12.
That is nothing
So
like
you're going to
horse
notice if your horse isn't.
Now I know I don't want to become a vet because I want to get So
Oh, don't worry. Owning a horse, you get in there too. Trust me.
Worth it, but
Get a long glove.
Yeah. Yeah, most of us have gloves that can go up to our elbow at least.
So I'll give you a
Sure.
beginner perspective. I was
Sure.
cleaning Captain's back hooves and I heard a squeak, and I got out of there very fast.
oh yeah.
Yeah.
uh-huh.
hmm
You will forget about that because you've been doing this for a long time.
Oh no. Oh no. If you've been doing it for a long time, you start to know it even before the squeak. You're like, he's shifting his weight. I'm out. I'm out.
Connor moves his tail one
Not.
specific way,
hmm
and I'm like, yep.
I'm good.
He's almost got me twice, so
Remy
I
does
learned.
it too. He just starts to shift his weight to his other leg, and you're like, oh, here we go.
One horse, I had just moved out the way in time, and they had diarrhea. It was not pretty.
Mhm.
Yeah, that's pretty much the opposite of colic.
Do we care about horse diarrhea? As long as their head isn't in the vicinity.
Yes and no. Sometimes it is simply my guts are a little upset. There is one virus, I think it's West Nile, where it's completely explosive. It's not just, oh, it's a little runny when they come out, it's projectile hitting walls.
Okay.
That's when you're going to have a massive problem because your horse is going to dehydrate quick.
Okay. Are you calling the vet or are you just
I'm calling a vet.
Okay.
Because generally if we're exploding like that, something is very wrong. I'm also
Does
going to be
G-
concerned if it's red or black.
Does Giardia affect horses?
What's Giardia?
It's a virus found in a lot of creeks and
Parasite.
streams.
Oh,
Yeah, it's a parasite.
Parasite.
I haven't done much research on that. I'll have to look.
That does cause explosive whatever in dogs, and I think humans.
And humans.
I haven't heard much about it in horses, but
Okay.
it's an interesting thing that I'll want to look into. But yeah, essentially they're going to be sending out so much fluid that rapid dehydration is not only a possibility, it's going to happen.
there was a horse named Bruce at the old barn. He had a lot of problems, like allergies. Like he had to stay outside. He couldn't go in the barn because of
Yeah.
all the dust, and which there is a lot of dust in Sturgis.
Yeah.
Now, is setting an IV something that you can do, or is that a do not pass go, do not collect $200, call the vet sort of thing?
So I know how to do it, but then you have, the whole, you don't have the medications for doing it. Because the vet's got to provide the medications. I know how to set one, and how to put it back in, but
So it's going to
generally
be
you're not going to.
hydration, possibly an antidiarrheal, possibly an antibiotic or anti-parasite.
Mhm.
Okay.
Do they have antivirals for horses like they do for humans?
It's really, at this point, it's more of a vaccine.
Okay.
So you can prevent it, but once the virus is there, it's more supportive care.
Gotcha. Is there a Lyme vaccine for horses now?
I'm not terribly sure, actually.
Oh, since they're close with dogs, I believe.
I don't think so yet, but that's another really good question that I'm curious about.
Because I know there's West Nile vaccine.
Are you talking about like a vaccine, as in like antibiotics, or like
No,
a
like a
vaccine?
vaccine.
No vaccine will prevent you from getting it,
For like Lyme disease.
Yeah, I wish that was in
right?
That would be nice.
Yeah. So those are your gut reasons and bleeding. What else? Talk about respiratory reasons. So respiratory distress may or may not be a call to the vet. If you have a horse with asthma, you probably have some kind of emergency medication, either nebulizer. They make horse inhalers. It is not fun to give, but you can do it.
I've heard that.
What's it like?
Think a giant halter with a big cup on the end, and you're just spraying the
That sounds
medicine
like
in there and
Really
hoping that your
bad.
horse stays still and breathes it all in.
That sounds really bad.
Your other option is you can do shots, a steroid shot, or there's a syrup called ventapulmin that you administer orally, and that's gonna hopefully help open up their airway and lungs so they can get air in. Anaphylaxis, call the vet. That means your horse ate something and now an airway is closing.
What would be the symptoms of that?
About the same as a human.
Okay.
You're gonna hear
Panic.
you're gonna hear them breathing. you're gonna see nostrils like completely flaring, like they've just run a marathon. Loud, like aggressively loud wheezing.
I have a question for the other end of the horse.
Yeah.
The tail.
Yeah.
Cuts, spasms.
Let's see. The tail's a pretty well protected area. You don't see much in there. It does help with balance, so sometimes.
If you notice that the horse has stopped moving their tail,
Yes.
what do you do?
I mean, check for heat and stuff, but if we have like a limp floppy tail and I lift it up and there's no muscle tone, because usually that's neurologic.
What's neurologic?
Brain.
If you pick up the tail but it doesn't move, or there's no resistance or protection, because they
Like
always
it feels
try
like
to
you're
protect-
picking up a stuffed animal.
Oh.
Whereas if you picked up a horse's tail now, they're gonna be like, hey, what are you doing back there? Neurologic horses are gonna be like,
I see a lot of horses this time of year. They'll try to scratch. They can't reach,
mm-hmm.
and they'll get bug bites or something, and they start scratching their tail, like rubbing against the fence.
Yeah, so that's just itchy tail. You might see it if your horse has got like a worm infection too.
Okay.
There's not much you can do for it. That coat defense stuff I talked about.
What about, like,
There's a powder
TMG?
form that you can, rub in there. MTG does work pretty well. The other thing you can use is plain Listerine because that's going to kill the bacteria. It just makes the tail a little bit sticky.
But minty fresh.
It is minty fresh.
There's apparently this horse at one of the barns near me that didn't have a tail. What does like that mean? Like when the horse doesn't have a tail? Does
Like the
it
tailbone
matter?
at all, or it just
No
No.
hair.
Chop low
No, like no tail.
at the dock. Near
Yeah.
the top plate. There's nothing there.
There's nothing there.
I've never seen that before.
I've never seen one with absolutely no tail. I know the Amish sometimes will dock a tail so they just have a nub. And the problem you have there is they can't protect themselves from flies
Oh,
because they use their tail as a fly swatter.
they also use their hooks, but that doesn't
Yeah.
work all the time.
That's not going to work all the
Yeah.
time, whereas the tail's constantly moving, keeping things away. Okay, so we've talked respiratory, we've talked digestive, we talked circulatory.
You've hinted at blood and stool. Is there anything more we need to talk about there?
No, not really.
Okay.
Blood and stool is a problem. So you see it red or you see it black.
It's internal bleeding.
Yeah. However, because this is a thing in New York, Virginia, you guys don't get as much snow. You might see a horse just pee in the snow and it looks red. It may not be blood. You kind of have to use your judgment. You might be like, wow, that's really concerning. Usually it's just a chemical reaction between something in the urine and something in the soil. It's completely fine. Now, if it's actively coming out red, that's a problem.
Apparently, people are trying to stop like horses being used in New York for carriage rides sometimes and stuff.
Yeah, I mean, they're doing that in the city.
Yeah, in the city.
Neurologic. What are some of the things that you'd want to look for in order to call the vet?
Let's face it, these horses look drunk. Like, that is how it's always been described to me, is a very drunken sailor type look. Horses aren't always great at knowing where their feet are in general, but these guys are going to have a splayed out stance of, I am incredibly unbalanced. Your neurologic symptoms are actually going to look a lot like your... Actually, neurologic is pretty much the same as if I just sedated them because it's blocking off the nervous system. So, yeah, a wide stance, not reacting to stimuli, floppy tail, sleepy look, head low. They're not gonna be able to walk in a straight line. There are tests you can do, like, hey, can you turn? Can you back up? Do you mind if I hit you here? And if you're not getting a response that's normal for your horse, that's anything neurological.
Neurologic is with the brain.
Yeah, brain, nervous system.
Do horses just randomly start getting seizures, or is that a symptom of something bigger?
All right, we're gonna talk about that. sometimes it just happens, like it can just be an onset. Sometimes it was there is a virus in there. There's a brain tumor, because seizures are going to come from the brain. So sometimes it's a virus, sometimes it's a tumor, sometimes it's degenerative. Those are your three options.
What does it look like in a horse seizure? I mean, like the flop, lay down and like a regular shaken and.
Yeah, so I mean, even in humans, there are different types of seizures. So sometimes they just space out.
Okay.
Other times they will fall over and thrash violently.
What does thrash like shake?
Yeah, just like limbs everywhere, and there's not much you can do. You just stand back and watch because
you get hurt.
You're gonna get very injured if you get in there.
They're gonna like kick you.
Yeah, it's completely unintentional if they do when they're in the seizure because they have no control of their body.
Have you ever seen a dog have a seizure?
No, because I'm not. I like dogs, but I'm not.
Okay.
A dog person.
Yeah.
You can't see it a lot in German Shepherds.
But
prone
yeah,
to it.
seizures call your vet.
Yeah.
Especially like,
Yeah.
I mean, like if your horse has a known seizure condition, usually after the first one, unless something's really abnormal about it, you're like, all right, oh, this is something that happened. But if your horse has never had a seizure before, or they've just had head trauma, something like that, vet.
What is the vet gonna do though? Because aren't they gonna?
Vet's gonna assess the situation and see where you want to go from there.
Also, I've always been wondering, why are the halters always on the horses when you put them out in the paddock?
You shouldn't be.
We'll talk about that later.
Okay.
What's the sign that a horse has had a stroke?
That's a good question.
So my friend's horse actually had a stroke when they were trailering back from a show. They didn't realize until they got back, and he was just down. They're gonna be on the ground, same as humans. There's gonna be weakness. Goes back to your neurologic horses. There's probably, it's not your horse. Like,
Okay.
it's as simple as it's not your horse.
Let's say it happens overnight and you don't see that the horse has been on the ground. Are there any after effects that would make you think that perhaps a stroke has occurred?
Telltale signs.
No, because they're not terribly common.
Okay.
So not off of my knowledge, but they're gonna have neurologic signs like that muscle weakness. So
Okay.
perhaps they're just dead.
When a horse passes out, or can they pass out, right?
I've never really seen one pass out.
Okay. Would they just stand in place, or
No,
would
they fall over.
Okay, that's
They
fine.
fall like a tree.
Kate, since we are in the middle of Virginia in the summer, what are some of the symptoms that, if you've tried everything you can to cool a horse,
Mm-hmm.
when is it time to call the vet?
They're not sweating, and they're previously known to be a sweater. That's heat stroke.
Okay.
What would you do? Just keep cold hose in the horse?
Yep. Keep them cool. And then the opposite for extreme cold, try to get them warm. Don't submerge them in hot water, but layer up their blankets. Like get them blankets. You might try like a little heating pad or something, but yeah, you don't want to do anything too drastic because then you're gonna shock their system.
Because if you put warm water on them, it's just gonna turn to cold water.
Yep.
So.
So heat, usually what we do to at least start treating it. I mean, you guys know we all cold hose the horses after lessons,
Yeah.
and that's just to help keep them comfortable. But in extreme heat, we usually keep some ice packs in the freezer just for this. Ice packs, bucket of water, let it sit for a few minutes, and super cold, and you just crank up the fan as high as you can, and you keep putting that on your horse.
Is there any particular areas that will cool them quicker, like with an ice pack? Or would you ever put an ice pack like on their neck, or like?
I mean, you might use
for
like
for heat issues, not like, oh, I think you pulled a muscle.
Yeah, no. I mean, you generally wouldn't ice for that, but anywhere a vein's gonna be close to the skin. So in between the hind legs, chest, neck, belly, butt. So large muscle groups and anywhere a vein is going to be close to the skin. Like I know we've all seen between the horse's legs, you've got those massive veins right next to the surface. So if you can cool the blood going through those, that's going to circulate through the system and help cool the rest of the horse off.
So all told, there is a list of things that could be handled in a barn,
Yeah.
but that list is much shorter than the list that says call the vet. Is that fair, or is it about?
It's about
50-50?
equal, almost. The more experienced you are, the less you're going to see yourself calling the vet. But like it's completely normal if you're an inexperienced new horse owner, nervous horse owner, whatever. Like a vet's going to understand. You just have to understand that it might empty your wallet a little bit.
Yeah.
But a lot of stuff you can treat yourself, or at least begin some kind of emergency treatment. It's the same how like if I'm a first responder, there's a ton of stuff I can do before an ambulance gets here. And it's at least going to make things a bit easier for an actual medical professional to take care of.
Immediate triage.
Yeah. With horses, you are the first responder. Yeah, that kind of wraps up. Anyone have questions? Because we're closing up on time. We've got 5 minutes for questions.
Just lots of
Yay!
Thank you,
Yeah.
Izzy.
Thank you.
Yeah.
Very
You're-
good
yeah, there's the
session.
pause button.
Is it this one?